Hello, William. Dr. Arculeo.
Dr. Muir, nice to meet you.
Nice to meet you.
I was just reading your thing there.
You're reading that, yeah. How was, did you find the office okay?
I did.
Okay, excellent. Well, welcome. I understand you found us on Facebook.
I did.
Excellent.
Today.
Excellent, good, right away, got in.
Yeah.
Good. So what specifically did you see in the ad that made you want to come in?
Well, I just so you know, I've had Dr. Oh my God, I can't think of his name now. Curtis Owens is my current chiropractor, Dr. Curtis Owens. But I had Sal Cirincione for like 30 years. I've been having back trouble since,
I saw
freshman.
that.
Yeah. So I've been dealing with L3, L4, L5, S1, either herniated or bulging or whatever you want to call it. I actually had an MRI done, and so I didn't do surgery. I wanted to avoid surgery. So if I stretch, I can get some relief.
I saw that you ranked stretching
Yeah.
high. Before we get into the details, which I want to ask you a lot of questions on, what specifically was it in the ad that attracted you to come in here?
Whatever the gadget you were using.
Yes.
I don't know what you're shooting in there or what it does. So I had some. Like that Cairo 1, I tried that.
Yes.
It helped a little bit, but nothing. So I just, I saw the ad and I saw the way they were putting it on the back. I don't know if that's I was just curious to see what it would do.
I understand.
You know what I mean? Because I've had every treatment except for surgery. I had the shots.
Yep.
What do you call that? The
Cortisone.
Epidural. Yeah, whatever you want to call. I had 3 of those.
Wow.
So. I just live with the back pain. I don't want to do surgery. I didn't put there, but I get the sciatica down the legs. Standing for me is terrible. Standing is brutal. And I was a policeman for 32 years.
Wow. Okay, well, thanks for the feedback on that. Sounds like you'd like to try something different.
Yeah.
I'll just tell you, it's a mechanical treatment. It's a new procedure that was originally developed in NASA Space Labs, and it allows us to find the problem with 4 layers of specificity in the diagnostics. Like there's 4 different factors they're looking at to find the problem area, and then very precisely guide the vertebrae back into alignment to get rid of the irritation on the nerves or the discs.
Right.
So that's been not ever done before. So this will be new for you.
Right.
And it's probably the biggest breakthrough in chiropractic or spinal care in general, because it's used outside of chiropractic, since the MRI. So it's a fabulous diagnostic tool as well as a treatment tool. So we'll show you. It's more like a jackhammer. It's not an injection, but it's a great procedure. We'll be scanning you today, and I'll explain more about it then. Let's jump in. I've got specific questions for you. And what I'd like to do is translate this into just words out of your mouth as far as symptoms. I don't want to hear other people's diagnosis or these levels. We'll talk about the levels of whatever you had, the L5. I'm impressed with your vocabulary, though, I'll tell you that much. But if you describe what you want to get rid of it the most, was it the low back pain or the sciatica? What would you like to get rid of the most right now?
The low back pain and the sciatica. Those 2 things are most
top of the list. Okay.
Right.
Thank you. And I'll just ask you some straightforward basic questions. You've had the low back pain for 40 years now?
Yes.
On and off?
On and off for 40 years.
Yeah. And it is pretty much daily at this point, and a 7 out of 10 in intensity.
And, 7 when I get up in the morning. It takes me a while to get out of bed, And then, during the day I stretch. I try to go to the health club most days. I do my stretching. It helps. But, I have a constant pain. It probably goes down to a 5, but then when you get up in the morning, it's back to a 7.
I understand. That's horrible.
Right.
Horrible. Okay, now, the sciatica is on which side, the left or the right?
Mostly on the left, but I've had it on the right as well. Okay, but it's mostly on the left side.
Okay, and how long has that been going on for?
Oh, the sciatica for at least 30-some years,
30 years, so
yeah.
Wow. And what about the right-sided sciatica?
The right side, probably within the last 10 years.
10 years.
12, yeah.
Got it. And when the sciatica is bad, the left sciatica, where is it in pain intensity from 1 to 10? 10 being the worst, 1 being no pain.
I would say about, a 6.
Thank you.
6, yeah.
Thank you. And how far down does it go down your leg?
Goes to just about the top of the calf.
Thank you. and the right sciatica that's been going on 10 years. What's the pain intensity when that
doesn't
happens?
go as far down, probably around a 5, but it doesn't go all the way down. It probably just to the mid, what do you call this?
Hamstring.
Hamstring.
Thank you. All right. Now you mentioned a break in the C6
Right.
in high school. Do you have any neck pain or stiffness?
I don't, but it's it's a little tight, but nothing that I can't deal with. I do the roller every day, the foam roller, when I go to the health club, so
Yeah.
that seems to
Yes.
decompress it or whatever you want to call it.
Right.
But
Excellent.
it fused with 5 and 7.
Okay, that was a surgical fusion.
No, it fused on its own. I never had surgery.
Oh, but you fractured it.
I fractured it. They diagnosed me as a pinched nerve, so I took 4 days off of practice, and I went back to practicing again, which was not a good idea, but
that was the time period,
yeah,
right? That's what they did then.
1979. I said,
79.
yeah.
Okay, now you've never had any surgery on the back, although you've had injections.
No surgeries. If I had the 3 injections, that was a couple years ago. It helped for a little bit, but
Now it's safe to say you've had while these treatments may have given you temporary relief. Is it safe to say that nothing's really gotten rid of it or decreased it markedly?
The only thing that helps it is if I stretch.
I saw the stretching. Yeah,
That's the only thing that really helps it the most.
the stretching helping, but it keep coming back to you. You have to constantly stretch as a sign of imbalance.
If I don't stretch, then the pain gets worse.
It comes back. So you're temporarily stretching out a compensation pattern. So we got to see what's causing that pattern, and then we might be able to do something about it. So has that been discouraging that you've just not been able to get a handle on this with the epidurals, with the rolling, the chiropractic you've had in the past, the physical therapy, the medications?
Yeah, I mean, nothing works. Just nothing has worked. So it's all been temporary stuff.
I got it.
So nothing has ever.
I hear you. I'm sorry.
No.
But I'll let you know right now, we handle a lot of tough cases that have been around the block, that have done this for a long time, and we get breakthroughs. I hope you could be another one of them. I'm not promising, but let's take it one step at a time.
Well, I even went to the Illinois Back Institute.
Okay.
So.
We've had a lot of patients that have already been there too. Let me ask you some practical questions, William. Do you like William or Bill? Bill. Okay, excellent, Bill. Just practically speaking, how is this back and sciatica problem negatively affecting you?
It's limiting my ability to, play basketball, golf when I want to, do family events when I want to. I have to sit most of the time when I'm out socially because standing is no good. So I need to sit. I like to dance with my wife, but I only can dance maybe 1 or 2, and then I gotta. My back is killing me. So it affects my social life. It affects my family life. It affects my hobbies. Even riding the bike actually helps it a little bit.
Right.
Riding the bicycle. So.
But it's cramping your style with all those other things you were just
Right.
telling me, dancing and all that. Is there? And how else does it negatively affect you? Any other ways? You're stiff in the morning. You told me.
I'm always stiff in the morning. I always got pain in the morning. It just the normal things of bending over, picking up stuff, or going out and get the paper, you got to squat down. You can't bend over, no matter what I do, if I have to move a chair or, any little thing like that, my son's strong, thank God, but, it's just the daily activities of life that you have to be careful when you do it,
Yeah, I got it. I'm sorry to hear that.
I also had prostate cancer. I don't know if it was in there. So I was diagnosed a couple of years ago. I had brachial therapy and I had radiation, 25 rounds of radiation.
You've done follow up and everything's okay?
Yeah, everything's pretty good right now. I'm at like a 0.03 for my PSA level.
Got it.
So it's down real low.
I hear you. Good. Stay on top of that.
But I think there's a correlation between a bad back, like and with the prostate, because I know there's got to be something.
The nerves, there is research on that. The nerves that come off the lower spine, the lumbar spine, right where you have problems, go to the whole reproductive area, affect blood flow, proper nerve function to that organ. treating the back is not a treatment for your prostate, but it helps the whole health of the area.
No, I know.
Does that make sense?
Well, I know, guys. I know every vertebrae's got nerves that go everywhere.
So you understand that.
Right.
Good. Okay. Is there anything else on a more positive note? Is there anything else you do more of or just enjoy more if you didn't have this going on as badly?
Oh, I would do a lot more recreational activities. Hiking, biking, golfing, walking. Walking would be nice.
Right.
If I could walk a mile, I would be happy. I can't even do that. Without being in pain.
Oh, that's horrible. Got it. So you may have already said this, so pardon me, but what would you say the most important reason why you want to get rid of the back and sciatic?
So I could function better in my daily life, and be able to do things that everybody else is doing. Walking, jogging, golfing, just walking with my wife. Social events, not having to sit down in a chair, all the time,
Right. I don't blame you.
Yeah.
Normal life.
Right.
A young guy like you. You're only 57. Come on.
Right.
All right. So this has been going on for years, 30, 40 years. Okay.
Yep.
Now I'm going to ask you a hard question here. What do you think could be like in a year or two if you ignore this and don't do anything about it?
I don't know what's going to happen. I don't know. I mean, it could get worse. I mean, I'm hoping right now it's at an area where if I do my stretching, I mean, I'm okay, but I still have the pain, but it's tolerable. If something's going to have to be done, surgery or whatever, I don't know. If I don't get it fixed now, because I don't want to be having surgery when I'm 65 or 70 on my back. I'm still young enough where I could have surgery and hopefully it'll do something. I don't know though.
I have to admit, there was a study that was reprinted in the New York Times just a couple years ago that said low back surgeries on discs, like would be the main focus for you, 84% the pain returns 2 years later.
Yeah.
Or worse.
That's why I never went and got
So
surgery.
it's not the cure-all that it's made out to be.
No, I don't.
Some people get lucky, but it's unfortunately I see a lot that don't.
Right.
So let's see how we could possibly avoid that, right? That's one of your goals in being here
I don't want to
today.
have surgery.
You don't want to have surgery. Got it. So this is a trend you want to change, and if you could turn this around, you'd like to.
I sure would.
Excellent. So now, another important question here to determine if I can help you or not is, just from 1 to 10, just mindset, where are you now? 1, you're not going to do anything about it, just like at worst. 10, you're going to do whatever it takes to get well.
I would say I'm around a 6 right now.
Excellent. Tell me why you're not a 10.
Because I'll tell you why. Because I started a new job, and I'm working for a gaming company that I get up early in the morning. I got to be there, like at 6 o'clock. I don't get out until 2 or 2:30, sometimes 3. I still got a senior in high school, and I got one that's graduated college and one in college. So, they go to Catholic school, so I'm paying a lot of tuition. You know what I mean? So I retired as a policeman for 32 years.
I hear you.
But I still got to work.
So you're talking finances, or you're talking schedule, or both?
Probably both.
Okay, finances, you're good in the sense that we're your Blue Cross Blue Shield PPO, right?
Right.
Today, it's just 19, you don't pay anything. We're doing the screening. You're going to get one treatment coming to you. It's an exploratory special program that we have with the Facebook to expose people that are suffering, don't even know, like you.
Right.
I'm glad you're here. Once we get on board, you couldn't be in a better place because we're in network with Blue Cross PPO. We're a provider for them for the last 15 years, so you're in a good spot. Probably make it very affordable for you. As far as time, schedule, you got to do it. There's no way around it. If we find we can help you, you'll have to make our way down here. But we have special techniques, but we're getting a little ahead of ourselves. If we're able to work out the right schedule for you, and we're able to fit your budget with your copays or whatever is necessary, where would you be from 1 to 10 if you're okay with those two things?
Well, I would be up there, in a 9, 10.
Excellent.
Yeah. I mean, and just like in the past when I've gone to certain doctors, if the city gave me 20 treatments, they just accepted what was provided.
There you
know
go.
What I mean?
I understand.
That's because I was a first responder. They did it for military and first responders.
Okay,
you know
well,
what I mean? So
we'll look at yours and we'll work with you however we need to, okay? Now, You told me you fractured C6. I will tell you this. I'll just back up and say the vast majority of our patients have experienced literally dozens of falls, injuries, and strains over the years that add up, that produce the symptoms you're talking about right now.
Right.
So it's usually not necessarily one thing. It's a lot of things. You were on your feet as a cop for a long time, right?
Right.
You broke your neck, which could throw off a lot more than just the neck. And you went right back in action. So what year was that? 79?
79, yeah.
Okay, thank you. When was your most recent car accident? I'm just going to survey a couple of these potential injury areas.
Probably like 2010.
Got it. Where you hit from the side? Did you hit someone head on?
Guy crossed over.
Oh my gosh.
Hit the police car, actually.
Oh my gosh. I'm sorry. Head on. And did you get any treatment for that?
I didn't get treatment because
treatment.
I hit my head on the window, but the side window. But I was working and I couldn't afford to take time off.
Oh my gosh. You're real. You're not a complainer. I can tell. I can tell that about you already.
No.
Now, any other car accidents prior to that?
I mean, the last one was probably, like in the early 90s.
Okay, what happened there?
We were T-boned. I was at work actually, and a guy went down the wrong way street on a one-way, and he T-boned us.
That sounds bad.
I was in the passenger seat, and I wound up in the back seat of the car.
Oh my gosh, you got thrown around. Any treatment for that?
I went to the chiropractor, and I had probably like 10 or 15 treatments.
Okay, so a little bit there. Good for you for doing that. Okay, any sport injuries besides the football injury you already told me about?
Let's see. I had my knee drained twice.
How are your knees doing now, by the way?
They're good.
Good.
But I injured my knee at work. I was chasing a guy, and I tore the meniscus, but they didn't do surgery. I was like 30. They said put me in a brace for 8 weeks, and then went for physical therapy.
So you're in a brace, kind of thrown off. You could have been wobbling, compensating.
Yeah.
That could affect the spine too. Any other slips and falls with doing your job or just around the city on the ice?
I used to play hockey as well. So I mean,
How many years you play hockey? I got to write that one down.
I played hockey.
That's serious.
For about 5 or 6 years.
I'm sure you took some hits there.
Played football, wrestled for like 4 years.
Well, William, let me cut you off at that and tell you that you had ample opportunity to knock your spine out of alignment and cause problems.
Oh, I know.
So
right.
We need to take a careful look at that. Let me tell you, William, we're a special clinic. We don't accept every case. We only accept cases that we know we can help, and we know the patient fits the criteria to be a patient here. And the criteria is, if we take you on, it's because if we take you on, we get good results because we take people on that are going to show up, follow through, do their homework. We give you a little rehab homework, the stretching and all of that jazz. So if we take you on, you think you could be a good patient? Have you had a history of being a good patient overall?
I followed through with Chiro 1 for the whole treatment process. I just I'm going to have a little difficult time getting down here in the afternoon because I'm coming from Hoffman Estates.
Okay, we have a lot of people coming in from that neck of the woods. We'll work it out. The timing is critical. And we have parking for you here too, by the way. I don't know if you know that.
Yeah, I parked down there.
Okay, good. I got to ask those questions to weed out people that aren't really serious about their problem. It sounds like you are, and it sounds like you don't want this to get worse and you don't want surgery. So we got to snap to this. Let's gather data today. Today will be data finding. We're going to do a special scan with the sensor from the computer you saw on that ad, on that video.
Yeah, right.
And we're going to scan you and get very detailed information of the frequency and the resistance of every segment in your spine. And then we're going to take a couple pictures, just some x-rays to screen what's going on. Not only do I want your back, I need to see the neck because of that situation you had there. Plus the neck affects the back. We're going to look at the whole thing. And then that's it for today. Then what we're going to do is I'll be meeting with my team probably tomorrow morning. We'll be going over all the details, all the factors. We're going to have a team meeting. We have a medical doctor on our staff, physical therapy team, 3 chiropractors, 1 being me, and we're all trained on the SpineTech technology. So if we all agree that you should be a patient here, that's a good thing because we have a high success rate, over a 90% success rate with the people who take it on. but we don't take anybody. If we think you shouldn't be here, we're going to be honest and straight with you,
Okay.
and we'll send you somewhere else.
Okay.
But this sounds like our specialty, and I like a tough case because you've had this for so long. I'd like to win where other methods have not totally really resolved.
Nothing's worked really. I mean, just
Well, I'd love to sit back a month or two from now and be smiling and feeling good with each other that we made a big success. That's why our hallway's covered with success stories. So we've helped many other cases worse than yours. So I hope you're going to be one of those, but I'm not going to say anything until we gather the data and we have you come back and we'll go over the results, and then we'll take everything up. And all you need to ante up is that $19 and you're good.
okay.
Sound good?
Sounds good.
Okay, let's head up front.